Good morning, members of Parliament, support staff, radio listeners, TV viewers, those following via social media, and members of the media. Welcome to the continuation of this urgent public meeting number 4 for today, Wednesday, November 8, 2023. I would like to give a special welcome to the Minister of Public Health, Social Development and Labor, Mr. Omar Otley, and his support staff. We have established a quorum of 10 members. Please stand for a moment of silence. Thank you. I have received notice of absence from the following member, MP Ludmila D. Weaver. Notifications. Before we proceed, I would like to convey condolences to Sunny Katnani and his family on the sudden passing of his father, Pishu Peter Katnani. May God rest his soul in peace. Viewing will be today from 5:30 to 6:30 p.m. and followed by a private cremation at Royal Funeral Home. Are there any other notifications? Yes, I see MP S.A, Wescot-Williams. MP Sarah, you have the floor.
Thank you, Mr. Chairman, and a good morning. Good morning to my colleagues, a good morning to all tuned in to this meeting, and to the Minister and his support staff who are present in this meeting here today. Mr. Chairman, I want to join you in expressing condolences to Sunny and his family, to Geeta and all of the others with the passing of their father, husband, and relative, and extend my wishes for much strength and at this difficult time for all of them. Mr. Chairman, on another note, I want to highlight again the fact that meetings of Parliament are not, in my opinion, taken seriously by the ministers involved. Mr. Chairman, as you would know, we were supposed to have the continuation of a meeting on the issue of ENIA, and the minister in that meeting has been postponed. We don't know until when, and the minister in his reaction to Parliament stated that he was expecting answers from the Central Bank of Curaçao and St. Martin, and up until that moment had not received such. So, Mr. Chairman, if this is the reason why the minister representing one of the two shareholders in the central bank cannot impress sufficiently upon the central bank that these were questions posed in Parliament, hence my statement that meetings of Parliament and topics in Parliament are not taken seriously by the ministers. It is 3 weeks since this meeting should have continued, and for the central bank just to say to the, or not even to say, the answers were promised according to the letter of the Minister of Finance, were promised by the central bank at a certain hour, and up until that hour, these answers were not received. So, Mr. Chairman, I would like it to be noted, I would like it to be observed that I do not believe that the ministers at this point are taking the meetings of Parliament seriously. Oh, yes, indeed. Thank you, Mr. Chairman, and my apologies. I was so talking about the meeting of that is actually not a public meeting, so my apologies for not standing at the start, and I think you were informed by my colleagues, so I thank him as well. But Mr. Chairman, I just want to reiterate the statement that I made regarding another meeting which would not have been a public meeting, and it would have been a Central Committee meeting of Parliament in which the minister was supposed to return. It is now about 3 weeks since that meeting started. Questions were asked, and to just be informed that answers were not received by the Central Bank of St. Martin, I think is an insult to Parliament in terms of the urgency with which ministers and institutions look at Parliament and Parliament deliberations. I thank you, Mr. Chairman.
Thank you, MP Sarah Wescot-Williams. I don't see any other for notifications. We have as agenda point for this public meeting deliberations on the proposed National Health Insurance under document IS/059/2023-2024 dated September 29, 2023. This agenda point was requested by MP Sarah Wescot-Williams, MP Heyliger-Marten, and MP Christopher Emmanuel. We go over to the agenda point. On September 29, 2023, Parliament received a letter IS/059/PV2023-2024 from MP Sarah Wescot-Williams, MP Heyliger-Marten, and MP Christopher Emmanuel with the request that an urgent public meeting of Parliament be convened with the above-mentioned agenda point. The presence of the minister was also requested. The meeting was convened on October 12, 2023, during which, after the presentation by the minister in accordance with the speakers list, members of Parliament were given the opportunity to pose questions to the minister in the first round. The meeting was then adjourned to allow the minister time to prepare the answers to the questions posed by the members of Parliament. Today, the minister has returned to Parliament to provide the answers to the questions posed by the members of Parliament in the first round. Hence, today, this continuation. I give the floor to the Minister of Public Health, Social Development, and Labor, Mr. Omar Otley, to answer the questions posed by the members of Parliament in the first round. Minister, your mic. Minister, you have the floor.
Good morning, Honorable Chairman, honorable members of Parliament, the viewing and listening public. I'm here today to dive right into the answers. So I move to the first question, MP Sarah Wescot-Williams. Is there a new date for enactment? Yes. The new date we're looking at is January 1st, 2025. Have the issue with the said been resolved? No, the issue is not resolved as yet, as no board members has officially been appointed as yet. Has the draft national ordinance been sent to the said? Yes, the draft national ordinance was sent to the said since March 7th, 2023. How was the enactment of the law projected? Was the law projected to go into effect in its entirety? The only option is to enact the new ordinance and the decree as a whole. The draft national ordinance provides that the national ordinance will enter into force at the time to be determined by national decree. This will consider the deadlines applicable for publication and entry into force. The LBHAM regulates that it will enter into force the same time as the national ordinance. Can you provide what ratio within our civil registries between Dutch nationals and those who are versus those who are legal residents? This information has been requested, but unfortunately up to now I have not received, but I would send you and the members of Parliament in writing, Mr. Chair. Explain how the undocumented persons not in our civil registry will be able to be considered for medical coverage. Only undocumented persons who work more than 20 hours a week and are paying wage tax will be eligible for coverage. All residents of St. Martin are entitled to medical coverage. All residents of St. Martin are entitled to medical coverage. To be insured is not linked with nationality, but if you are a resident or registered at our civil registry. What is the status of the population census study? I'm happy to announce that the population census study is completed and was presented to the COM a week ago, so the information will be disseminated slowly. Soon and slowly. The reason I say slowly is the fact that there will be presentations given to some key groups before publicly disseminated. Where does the NCD strategic plan fit into the SAHA? The NCD strategic plan is something that will help, and we promote prevention against non-communicable diseases such as high blood pressure, cardiovascular issues, and diabetes. These are programs that that will be put in place to help deteriorate the growth of these diseases. And by SAHA being a motor for prevention, they go hand in hand. Do we not have sufficient data to make a decision regarding healthcare on St. Martin without symposiums and surveys? Proper data is very important. As minister for the past 2 years, I have sat here numerous times on the floor of Parliament and been questioned by members of Parliament on updated data. And when I would refer to the data being from 2015, members of Parliament would say, it's a shame and we need updated data. So I agree, new data is needed as times has changed. And in order for us to make prudent changes, I think it is very important. And also as far as symposiums, symposiums are very important. As Minister of Health, I deal with many organizations, healthcare institutions. And the thing is, we focus only on one institution at a time, whereby in St. Martin, referrals are mandatory. Dr. A would have to send you to Dr. B. So the symposium, the idea is to have one trajectory on how we move forward. So it is important. I do feel it's very important. Is this one law going to undo all medical insurance? All ordinances regulating social health coverage will be replaced by the SAHA ordinance. Are any actions being undertaken to correct the legislation to enable categories to be insured? Does the minister not think that it does not require rocket science? While it does not require rocket science, it does require legislative trajectory. And MPs, as well as ministers, know very well that even if you amend a law, it takes the same trajectory as creating a law. So I do not want to give the impression that just by amending a law, it will be done tomorrow. However, I see no need to amend the law at this moment when I already have SZV 1B at its final leg at the Council of Advice, which will take up what you are requesting, MB. When will the legislation that will repair the issue of the 60+ vendors, taxi, and coverage? This goes back to the same SZV 1B that is currently at the Council of Advice, and the status at the Council of Advice says it's in review. So once it is brought back, we will do the NADA report. Once the NADA report is done, we will go to the Council of Ministers. Once approved, then we bring it to Parliament and hopefully to have Parliament's blessing. Is it the plan to approve 1B before GHI, SAHA? Yes, it is. Given the circumstance, it is prudent to have 1B approved before the SAHA. How does the financial paragraph of the draft law look? In a detailed annex was provided to the members of Parliament and attached to the packet. How, in the new system, can it be guaranteed that funds such as AVBZ continue to exist in whatever form? AVBZ is merged into SAHA. Coverage and premiums are included into SAHA ordinance. By merging several funds, more solidarity and risk pooling is created, both added to improvement in the financial sustainability. The current financial status of the funds will not remain the same in the future. Treatment options and care need change over time. Has any consideration been given to include coverage for addiction? Yes, it is included. I move to the question of MP Pantaflet. How will the solidarity premium work? Please explain. The solidarity premium compensates SAHA for its investment in its availability of healthcare infrastructure, which is also available for privately insured persons, as well as premiums for long care beyond 90 days, AVBZ, which is not covered by private insurance. The solidarity premium is a yearly premium, which is a fixed amount per person. It is not related to salary, income, nor premium to be paid by private insurer. MP Panaflet, is the 400 million, explain the 400 million owed to SZV. The 400 million is an accumulated deficit, negative reserves of public health funds, ZV, OV, and FZA. Accumulative deficit. MP Heyliger-Marten, how can the government guarantee the sustainability of the healthcare funds? A clear, detailed annex was provided and to the members of parliament that shows the financial sustainability. What exactly is the holdup with the said? We are awaiting finalization of board members. What is the one-time opt-out? What are the financial ramifications? The opt-out option is a solidarity premium that is paid yearly, a fixed amount per person. The employer does not have to pay on the employer part. So the opt-out is for persons that do not want to remain under the SAHA and choose to go back to their private insurance. However, you'll be required to pay a solidarity fee. The solidarity fee is matched and compared to what you are currently paying, which is your AVBZ, which I have stated is not currently covered by private insurance, so they are paying it at the moment anyway. What is the Department of Labor doing to combat issues of business not being SFA and tax compliant? How does the communication go? Well, the Department of Labor Affairs can only act once a complaint is brought forward. As far as SZV, collection projects have been commenced, and control and inspection department is designated to zoom in on defaults. MP Angelique Rumeau, starting with understanding the foundation of SAHA, can you provide a brief overview on the main drivers behind its creation? The main drivers are the unsustainable financial situation, the ordeal for persons who have no access to health insurance, lack of solidarity and risk pooling, unequal access to health care are the main drivers. How does SAHA plan to address and recover the deficit, especially with the increased cost of care? A detail was provided in Annex 1 that shows all the financial figures. The reason that I'm saying that it's provided, it is very, very detailed with all the finances. So it is provided Annex 1. Okay. Who specifically will be added under the SAHA? Well, sole proprietors for one. The taxi drivers that we speak about, the bus drivers that we speak about, they will be able to now be insured. Privately insured persons, if they do not opt out. Also, co-insured persons will not be added, but it will be an individual premium base. The criteria for eligibility, in which you asked, through you, Mr. Chair, which your MP asked, all persons registered in civil registry and living on St. Martin, irrespective of their nationality, will qualify. Undocumented persons who pay wage tax for at least 20 hours per week. With the opt-out, won't we see a decrease in the pool of premium payers? Agree. Indeed, opting out affects solidarity and sustainability of the fund. To compensate for the effects of sustainability, persons who opt out will pay a solidarity premium, as stated. What measures are in place to handle potential abuse within the system or by our own residents? I agree. There should be measures in place. The opt-out option, as a younger, healthy, wealthy, will have to go to private insurance. And what happens is, once they reach their maximum of coverage, most of the time, they revert back to the general pool. If there is a health screening and they have pre-existing conditions or developed conditions, most of the time, they revert back to the general pool, in which we don't have you when you're young and healthy, but we have you when you are now sick. And also, we will use, in addition, we will use through technology and automation, where we will be able to tackle areas such as abuse real quick. For example, we will now be able to avoid providers billing excessively for a service rendered once. So a prime example, as I have stated, SZV has caught care providers who are billing for numerous healthcare provisions when they found out that the person only visited the doctor once. So this has been going on. This has also been published by SZV. How does the system plan to sustain these additions? How does the system plan to sustain these additions in long term without significantly hikes of premium? It is important to note that the need for dental, optical, and any care is not linked to affordability. Whether it is affordable or not, the people need dental care, glasses, and chronic care. We have to make sure that it can be financed and made available for the ones who need it. SAHA puts us in a better position to find a solution for funding. The objective of SAHA is to ensure sustainable access to care for people who need it in an affordable manner. This question has been posted by MP Rameau and also MP Solange Duncan. Given the past financial challenges SZV has faced, what makes you confident that SZV can handle the SAHA? It is important to note that the initiative of SAHA has taken more than a decade ago. SZV was established around the time at 2010 and has made significant improvements over time. Over the last two audits, I'm proud to say, under my tenure, 2021, 2022, SZV was able to obtain 2 unqualified audit reports in its financial statement, following continuous improvements in reporting processes. So SZV has shown tremendous improvement, and right now we are on the verge to have 3 unqualified reports. You also mentioned, why don't we learn, the MPs, through you, Mr. Chair, also mentioned, why don't we learn from Curacao and Aruba? In Curacao, there was no opt-out fee. That is one thing that we learned. Persons were able to opt out with no solidarity fee. And they also did not allow undocumented persons in their general health insurance. In Aruba, it's quite unfair to say that it is unsuccessful. Of course, there was their hurdles, and the main driver in Aruba was what we spoke about. They went from a standard fee for healthcare providers to fee per service, in which billing was then out of control. Some healthcare providers in Aruba made up to 400,000 guilders per month. They then understood their shortcomings, regulated, and actually Aruba is doing pretty fine as we speak. MP Duncan, what mechanisms and policies will be put in place to ensure compliance? Through automation, exchange of data between the Civil Registry, Tax Department, and SZV. This is something that was not done before, the collaboration between the Tax Department in the planning of this legislation. It was deeply taken into place, and they were involved straight throughout this new legislation. How will the increase in service and process be managed? Will new staff be hired? It is not the intention for new staff to be hired, but there will be a team of change managers brought in to assess the organizations in order to get them ready for the new shift in operations. Automations and technology will be essential in our approach to dealing with the new SZV under SAHA. Will the coverage for anti-conception be included? Birth control, pills, IUD, abortion as well? Yes. Coverage for anti-conceptions include birth controls. However, as it relates to abortion, this is currently illegal based on current law of the land. In countries that have universal health care like Canada, etc., we see an extreme waiting period at the facilities. Do we foresee that happening here? We do not expect a relevant change to the respect of waiting time with the introduction of SAHA. St. Martin, the availability of sufficient capacity in health services is regulated by manpower and health institution planning. We are working simultaneously to try to decrease the overcapacity and the burden of our population and patients. As you can see, we just opened the urgent care, the non-emergent urgent care, the HAP in Simpson Bay, and we are actually in discussions to see, based on the success of this pilot project, we are in discussions to see if we can actually do another, so we would be able to accommodate persons. But I will explain in my final speech why I don't think we will see a drastic increase. What is the difference between civil servants and the general public when we look at premiums? As stated, MP, civil servants at the moment pay a premium of 4.75. They will then have to pay 5.7, which is an increase of 0.95%. But what will be added to their package is the option of preventative care, whereby if you're pre-diabetic, your nutrition plan might be covered, your exercise plan for up to a certain amount might be covered, etc. As it relates to private insurance, your premium will remain the same. They pay 5.7 and it will remain 5.7. What will both government and SFV do to ensure that the public feels safe and trust the quality of care? A public awareness campaign is one of the most important preparatory activities for the implementation of SAHA. A correct imaging of quality of service efforts to serve everyone respectively and friendly. I move to MP Richardson. How will SAHA be sustainable? This is one of the main questions that has been asked by every MP. It is in the annex where a total breakdown of the financials and projections are given. What is the healthcare going to do for humanitarian part? SAHA ensures more access to healthcare. Currently, there are a group of persons who do not have the possibility to be insured. I would also like to say that SZV at this current moment, we hear MP Sarah Wescott ask about the formalization of 60 plus. This is indeed acted at this moment in a humanitarian basis. These are stuff that we are now in SZV 1B formalizing. Stuff even as simple as referrals. So we are in the process of working, and at this moment, SZV do work on him.
Minister, I would like to adjourn for 2 minutes for the children from the school to come inside. Okay. Meeting adjourned for 2 minutes.
Yeah. Yeah. From the very first question.
Welcome back, and I would like to give a special welcome to the students from St. Joseph's School and the teachers from the Group 7 and Grade 5. Welcome to the children here to be here for 30 minutes. Sister Borgia School, okay. Thank you for that correction. Minister, you have the floor.
Definitely. Thank you, Mr. Chairman, and a hearty welcome to the students of the Sister Borgia School. So, I move to the question of MP Lumira De Weaver. Why is it that SAHA has taken over 10 years? What is the roadmap? My honest opinion, lack of political will from then sitting members of parliament. In my opinion, lack of community-based approach and no proper involvement of stakeholders such as tax office and census registry to ensure proper compliance. Request the financials of SZV for the last 5 years. It has been sent on the website, the condensed version, and right here, Mr. Chairman, we would book in the detailed version of the 5 years of the financials. So I would definitely hand it to be booked into the members of parliament. What is the impact since the raise in the salary cap to 120? Financial impact of the increase of wage limit is approximately an extra 1 million guilders per month. So we have seen some success by this raise. Please provide a copy of the business plan for the SAHA. In Annex 2, you will find the entire information of the background and the reasoning. The business plan is in Annex 2. Please provide an overview of their complaints, no details, but their complaint procedure. When it comes to non-medical aspects such as logistics, boarding, and customer care, the SZV and care providers conduct surveys to determine the client's satisfaction in their services rendered. The SZV has a complaint process through their customer care department, which conducts interviews with persons with complaints and in collaboration with medical referral department, address the concern, resolve it, and prevent it from reoccurring. No SFA client should feel reluctant to convey their complaint, nor positive experience through the described process. Clients can make use of the Facebook, email, personal contact to express their satisfaction or dissatisfaction. What about quality control and audits? Regular evaluation meetings are held with care providers locally and abroad to discuss any issues, improvement concerns that arise based on contractual agreement. The SFA has taken note. The SFA has to take its jurisdiction into consideration when it comes to quality control. When it comes to medical care, it is the respective health inspectorate that are responsible for these controls. Are the payment of government to SZV for the loan current? In the original question, it says the payment of the government building. However, the government building is not a loan, but a rental agreement, and it is current. Has the government/ministry looked into amending the law to avoid insurance companies from discriminating against pre-existing conditions? Under my tenure, I can speak. I am not cognizant of us looking into such law at the moment, but however, the SAHA and the general insurance does not discriminate from pre-existing conditions. How long can they guarantee the premiums will not be increased? It is difficult, if not impossible, to give a guarantee with respect to premium increase. But what I can say is that with this course of action, it delays further the increase of premiums at this moment. Is SFA using SCUMA funds right now? No. SFA is currently cross-funding deficits, ZV, OV, and FZAC, with the surplus of AOV, AWA, the CESS, and the AVBZ. Cross-funding means that the ZV and OV and FZAC must pay back these deficits to the other funds. A SCUMA funds is a cross-subsidy. In that case, ZV, OV, and FZAC deficits are subsidized with the surplus from the other fund. The latter is not the case, so SZV is not using SCUMA funds. Each fund is regulated differently and would require a change in legislation. There's a legislation process ongoing and in anticipation of the introduction of SAHA. To take number of measures will improve the financial situation and sustainability of the current health insurance fund in short term, and to formalize a number of important topics currently have no formal legal basis within the legal framework of the so-called Draft 1B. What is SFA's current compliance rate? The compliance rate for premium payment of ZV, OV, and the CESS fund is around 90%. SFA cannot give a compliance rate for the other funds due to the fact that the levy of these premiums is not done by SFA. Those who opt out have to pay a solidarity fee. How can SFA ensure compliance? Compliance will be enforced by SFA adhering to the current collection legislation and policy. Compliance will be further enhanced through and better collaboration with the Civil Registry, Tax Office, and SZV. We have good and not so good employers on the island. Some who comply, some who don't. Some who take out money for premiums, some who don't. How is this being addressed? SZV will continue to enforce current collections, legislation policies. SZV will further address the issue by tackling the sector with a low compliance of premium pay in comprehensive collection project. MP Rayon Peterson, MP just requested the question and answers from the unions. Mr. Chair, as I have always prided myself on respect and a quality of presentation to the members of Parliament, I just want to illustrate to them and the members of the viewing and listening public the reason that in the annex, you can find the financial sustainability, the elucidation, the financial model in Annex 1 and in Annex 2, the approach and business case, unsustainable financial situations. You will see as well the premium base, the financial model of that. You will see the numbers and graphs that illustrate our calculations. You will see the plan of approach as well. And all of that is included in the annexes that I provided. As well as I would like to state something very clear. I think we have a misconception of the SAHA. And I'm happy to say that since answering the questions with the unions, we have maintained contact and we have sent email where we would have a grand presentation to all of the union members, but the understanding is now there. most of the persons that are quote unquote, I would say, I won't say complaining, but worried, they're worried because of misinformation. Being misinformed that they will no longer be SZV, that the premiums will be raised dramatically. 80% of our population are already in our general insurance. You are already here. We are not bringing anything new. You are already insured under SZV. All we are doing is enhancing your package, what you are already in. So the viewing and listening public, if you are covered by SZV, you are already in our pool. So we are not bringing or redesigning a whole new structure. We are adding to this structure. So when I hear it can't work, it won't work, but 80% of our population are already there. What we are trying to do is add sole proprietors, add people that deserve to be insured. Sole proprietors can insure their employees but cannot insure themselves. So they will be added. Who will be added? Persons that make more than the 120 with an option to opt out if you feel like, but you'll be obliged to pay a solidarity fee. So I like to make it clear, SZV insures 80% of our population already. So for those 80%, you have no need to be in a frenzy or in a worry because you are already in our pool. Thank you.
Thank you, Minister. Does any member have a point of clarification? And I see MP Sarah Wescot-Williams. MP Sarah, you have the floor.
Thank you, Mr. Chairman, and a good morning once again. Mr. Chairman, through you, I want to thank the Minister for the answers provided to the questions by members of Parliament. And in terms of clarifications, I would like to hear from the Minister on the following matters. The issue of the SER, the Social Economic Council, where, according to the Minister, the draft General Health Insurance Law was sent in March of this year. So it's the General Health Insurance Law, the big law that is going into effect on the 1st of January 2025 has been sent to the SER since March 2023. However, according to the Minister's presentation, the issue with SER has not yet been solved. So, can the Minister please clarify what is the issue with the appointment of the board member to SER? One, what are the relevant ministers / the COM doing to get out of this impasse? Are there any steps to be taken? Or are we going to go through 2024 still with an issue at the SER that would then not have been able to look at the draft law that is with them, is my question. So specifically some answers regarding the situation of the SER. And then, Mr. Chairman, I need to hear clearly, because the Minister has spoken about 1, undocumented persons, 2, residents and citizens. Normally, when we refer to residents of St. Martin, we speak of the persons not of Dutch nationality per se, but registered on St. Martin. Those are our residents. Citizens are usually those of the Dutch nationality. But then the Minister said, and this I would like clarified, undocumented persons also fall under the law. In my first set of questions to which the Minister has responded, I asked how that will work out legally speaking. Because if you have someone who is not documented, undocumented, the Minister said, and that person receives insurance, then and that person needs to show some kind of status on in the country, how do they do that? Where do they? So, would this mean that by becoming insured under the GHI, that then some type of status is given to these persons? Is my question. How is that worked out legally? In answer to my question regarding the population census, I've understood from the minister that the results are in and are at the COM. However, the information is going to be shared slowly and to key stakeholders. From what has been presented to the COM, the Council of Ministers, is the Parliament considered a key stakeholder to receive the results of the population census? Is my question. The minister has not, according to me, addressed where we are with the STEPS result, which is also a survey, if the minister can elaborate on that. And then the minister indicated, and I saw him take out and outline the package to which he referred, and I want to confirm whether that is all of the financial information on the GHI. So is that what is in that package and the annexes, the financial information, or is it the financial information of SZV in general? So are we receiving the financial outline, which I asked for, by the way, to a law that we haven't yet seen per se? So is my question to the minister. The minister referred to the improvements by SZV regarding, and the level of improvement is judged by the fact of having received unqualified reports, annual reports. In terms of the financial position itself, are there improvements there? And if so, which? I heard what increasing the threshold has brought. I think the minister mentioned 1 million, but overall, are there also improvements in addition to the process of an annual account? Are there also financial improvements, and if these can be shared? And then I want to understand from the minister. So the minister said that at this point in time, my proposal to adjust the sickness insurance law via a national decree containing general measures, because the law right now provides the possibility for the minister and the government to expand the category of worker employee right now. Right now, the law says that in addition to the category of workers as outlined in the law, the government, the minister, has the authority by national decree to expand that. So my suggestion was to the minister, do that by national decree. You can. The law says you can. You can then decide, well, who are excluded now from medical insurance can be included because they can be given the categorization of worker. So minister said, no, right now we have the changes of the SZV law, and the minister calls it 1B, that they are with the council, not they. That is with the council of advice to have now these changes made that will then include those currently on humanitarian reasons, the vendors, the sole proprietors, the taxi and bus drivers, and those that form part of that grouping. So, Mr. Chairman, if we look at that, then my question would be, okay, what is then the minister's projection for the implementation.
MP
Yes,
Wescot-Williams.
sir.
I think we should be talking on the topic questions which were there, but no additional questions you may pose.
Excuse me,
and the
sir?
clarification.
Excuse me, everything that I'm saying right now is precisely what I have noted that the minister stated, and I'm asking
Yeah, I'm just
that it
saying
be
that,
clarified.
yeah, keep it in that level, because a couple of the points were out of, like a new question.
Well, that's your opinion, sir. I'm asking the minister to clarify what he stated and read to the members of parliament. Thank you, Mr. Chairman. And as I was saying, so I'm asking the minister, since this law, the changes to the SZV law as announced by the minister, is with the Council of Advice, what is the projection of the minister for this law to go into effect? Just like I ask it for the general health insurance. Mr. Chairman, I await the answers to these clarifications, and then I will continue in my questioning in the second round. Thank you, Mr. Chairman.
Thank you, MP Sarah Wescott-Williams. The next person is MP Duncan. You had first registered.
I was going to tell the minister. Yes, that's true. Thank you, Mr. Chairman. Good morning to you. Good morning to my colleagues, to the minister and everyone here. I was just going to ask the minister if he forgot one of my questions, but I'm seeing that it is responded to in written form. So the minister didn't verbalize it, but that's okay. So I'm reading it now. I also want to ask, Mr. Chairman, if we will take a pause, because it's quite an extensive response or document. So I wanted to know if we're not going to go into the second round right away. No. Okay, thank you.
Thank you, and I don't see any other member of parliament asking for clarification. So I will look to my right to the minister if he's ready to answer right away, or you need some time. 5 minutes? Okay, I'll adjourn the meeting till 11:10. And I would also thank the students from Sister Borgia School, and hope you enjoyed the small session that you watched here. Thank you all. Meeting adjourned. welcome back, and I give the floor to the Minister of Public Health, Social Development and Labor, Mr. Omar Otley, to answer the point of clarification, comments posed by members of Parliament in the first round. Minister, you have the floor.
Thank you, Mr. Chairman. I'll dive right into the clarifications by MP C.T. Wescot-Williams. Through you, Mr. Chairman. The first question was the issue with the SAD. What is the issue with the SAD, and what is being done to rectify this issue? The issue with the SAD is the appointment of a particular organization. I'm not obliged to divulge the name, but it's the appointment of a particular organization. What is being done? We are now following the recommendations given to us by the ILO, which was given to us by the Labor Conference on the matter to recommend it to rectify this matter. So we are following the recommendations by the ILO to rectify this matter. Please clarify how it will work out as it deals with undocumented persons. This goes back to exactly what was stated. We are not creating something new. Currently, under the ZVA law, it does not discriminate access to care based on residency. Once a person pays premium or pays a persona, they are eligible to receive coverage. Currently, under ZVA, undocumented persons that work for 20 hours or more are currently covered. It is important to understand that persons who are already in the package will just receive an enhancement package. So, not to the good MP, but for others that are trying to create as if undocumented persons will now just be granted some sort of citizenship is not true. We are just continuing what is already being done and enhancing it. The census report, will it be provided to Parliament through you, Mr. Chair? Yes, MP Wescot-Williams, Parliament is considered a stakeholder and it will be presented to you. The package provided financial information of ZVA. This package that we speak about is the financial information of ZVA, and in the attached documents you will see the information of the GHI, which was emailed. Okay, so this will be booked in as Parliament, and it goes into the next question that was asked. Is the financial situation of ZVA improving? Yes, it is improving. You will be able to see as well in their financials over the past 5 years, the improvement, and also hence the reason they have received unqualified reports, improvements in their financials. The sickness insurance law via LBHAM always expands the category. So I understand in which you speak of MP, through you, Mr. Chair, but however, it would still require the legislative trajectory as the LBHAM needs to go to the SAD, then the Council of Advice, and then the Governor. The only thing different is that it won't need to be brought to Parliament. As it pertains to ZV 1B, the projected is first quarter 2022. It is already in review. We are expected to have it back by end of November, December latest, in which another report will be provided, sent to COM, and then it has to make its way to Parliament. So we look at first quarter 2024 for implementation. That was the clarifications of the Honorable MP C.T. Wescot-Williams. Oh, yes, sorry. MP C.T. Wescot-Williams asked for questions of the update on the STEP survey. We are expected to do 3,400 interviews. We are 1/3 of the interviews done. We are expected to meet our trajectory by April 2024. That was the end of the clarifications, Mr. Chairman.
Thank you, Minister Otley, for your clarifications. According to the speakers list, we go into the second round now, where the speaking time is for 10 minutes. And the first speaker is MP Sarah Wescot-Williams. MP Sarah, you have the floor.
Thank you, Mr. Chairman. Mr. Chairman, I've taken note of the of the position by the minister regarding the amendments to the sickness insurance law to include the persons who are currently not included at all. So not even based on humanitarian reasons or the like, they're just not included. And the minister said the current amendments to the law itself, so the ones that have to come to Parliament, that will cover that category. I still want to get a better explanation, even though it is done now, how it is done when it comes to undocumented persons. And Mr. Chairman, during an earlier meeting of Parliament, I highlighted what some of our persons, some of our people, rather, that actually are documented face today where their medical insurance is concerned. And I mentioned the last time in the presence of the Minister of VSA, I mentioned a case. I mentioned a case of someone who got the first permit via the Brooks Tower Accord. That permit was subsequently transferred into a indefinite residency permit. Based on that, the person could have brought his wife with him, and the wife too got permission, got residency. But, however, right now the requirement, mind you, these have papers, but right now the requirement is that these persons get a private insurance. So what we have today is that many of these persons are walking around with a nearly completed residency permit, except for the fact that they were not able to provide proof of a private insurance. Wife, also, same thing. Wife got permission, but needed to have a private insurance. Many of these persons are at the most, minimum wage earners. How and where are they going to, at this time, afford a private insurance? The particular case to which I refer, there's something I pulled out of the sky, it's an actual case. And since the presentation to the minister, and I mentioned this, I believe it was yesterday, since I brought the case forward, the gentleman got a stroke. But he is a near resident because he received permission, but the clause on the permission is to have an insurance. Are we not fooling ourselves as we seek to legalize persons, especially that category of persons, and then basically tell them go get private insurance? I say all of this, Mr. Chairman, to say that amending the law to include everyone cannot wait. That's the point that I'm making. Because the GHI that was announced on 1st of January 2024 has now been delayed with 1 year. And now it's January 2025. In the meantime, we have a law at the Council of Advice to change the current situation. And the minister said, yeah, the national decree that can be issued by the government, it's a law. Of course it's a law. It's a law, but not needing to be ratified and passed by Parliament. Because we know how it can go when it comes to getting laws ratified in Parliament. We have seen them, especially where GHI is concerned. So I wanted to bring that forward and understand, Mr. Chairman, more closely how, when covering persons that have no papers on St. Martin. How does that work legally? You know what happened to the case that I mentioned with the gentleman and his wife, and who subsequently got a stroke? So he was taken to the hospital. And after the initial whatever care, whatever consultation was given, was sent home. And who's going to help? Who's going to take care of him? Who's going to look after him? So there's a certain facade behind which we don't see the consequences of some of these actions. So has the discussion about ensuring residents and undocumented, depending on their categorization, has this been discussed with the Minister of Justice? That is the one who issues the residency permits and requires medical insurance. I want to address the matter as well regarding the Social Economic Council and our SER, and the statement by the minister that now we are going to follow the ILO recommendation where solving the issue of the appointment of a board member to SER. And can the minister be a little more specific about this ILO recommendation? So what is going to happen with and about the appointment of the board member of the SER? What does the ILO, by the way, the International Labour Organization, what does it say to get out of the impasse that seemingly we're at with respect to the board of the SER, which holds back the dealing with the law for a general health insurance? So, Mr. Chairman, if the minister can, there's not much more that I ask, but if the minister can address those issues a little more clear in terms of giving some specificities on the matter. I thank you, Mr. Chairman.
Thank you, MP Sarah Wescot-Williams. The next person is MP Rolando Bryson. MP Bryson, you have the floor.
Thank you, Mr. Chairman. Good morning to you, my colleague members of Parliament, the Griffier, the Honourable Minister with us today and his support team, those in the Tribune, and those following this meeting. Mr. Chairman, I don't have many questions because I think the Minister has done an excellent job, not just verbally, but also in writing, providing a lot of the information and clarity that we've needed in addition to his original presentation. I think it is very clear to me that what we are doing here is a win-win-win situation for all parties involved. And I just had 3 points that I really wanted to add for further consideration, which are things that maybe can be considered along the way as we move towards having this whole legislation enacted, ratified, etc. The first point is, one of the issues, and the Minister and you will know, this is something I have continuously tried to tackle, is the issues that many face with banking in St. Martin. And the reason why this ties to insurance is that now that the SZV, rightfully so, has been transitioning as much as possible to a digital infrastructure, we have to consider that most digital infrastructure would require some form of banking, credit card payments, wire transfers, and so on. As we expand the pool, and we mentioned that, yes, there are people that may be undocumented or in the process of getting their documentation, will fall within this pool. My question would be, what are we doing to secure their ability to have a bank account? Because even with the legislation, which I understand now is in its final, the NAD report is being vetted by the central bank, so I hope that will be with Parliament soon. But even that legislation gives the right to a bank account to residents of St. Martin. So you would have to be registered in the census office. So as wide-sweeping as that legislation is, you will still have an issue with those that fall under SZV but won't have a bank account. Would it not be an idea that the SZV can do as what many other pension and insurance, social insurance institution has done, and that is to establish its own bank? That would solve, I think, this issue for itself. They can build their own requirements for who should have an account at this. I think it would be a very social thing to do as well, to ensure that everyone that has social coverage does not fall out of the banking system. I think it can assist government, because we know the situation in St. Martin now that we do not have a single local bank in St. Martin. I've heard Mr. Carty in previous parliament meetings mention that it is something they're looking into, and I would like to know if there's any update, if the SZV is going in that direction, because it's something that I would definitely applaud and encourage for the SZV to set up a banking institution. The other consideration I would like is, in the process of creating this general insurance for everyone, one of the things I think should also be considered is a sort of social security number system. We have a crib number, ID number, Chamber of Commerce number, your SZV number. Would this be an opportunity, being that this will now be an identification or a number that almost everyone in the population would have? Would that not be the perfect moment to now finally integrate all of these different numbers and have one, like they have in the Netherlands, I think it's called BSN now, used to be called Sophie number, one general number that covers all of these issues, whether it's a tax, whether it's your SZV. Can that be something that can be considered? I know that will fall perhaps on the other ministries as well, but the goal to integrate these different numbers into one, I think, can be spearheaded by means of the general health insurance, or let's say simultaneously with the establishing of that. And the third thing, Mr. Chairman, a lot of concerns and so on about, you know, undocumented and the people that are working and paying into SZV. Mr. Chairman, I firmly believe that most of the people, if anybody is walking into an immigration department with documentation, with willing to pay, willing to abide by the law, and are making that effort to be a part of society, I can say that in most cases, their effort is sincere. The people that come to St. Martin to do bad things don't walk into the immigration department or labor office. They stay off the books. But I think what we need to do to curb this issue is kind of move to what we have called in Parliament to a pay-to-stay system, where it is very clear what your contribution has to be to St. Martin in order to be a part of our economy and our community. So I do think that's also a consideration that should be taken that can help ease the number of undocumented, because it will be very straightforward, a straightforward merged process of labor and justice that then simply has a fee attached not just to the employer, but to the responsibility of the employee to pay for the privilege to be a part of our society, but contribute to those that have social needs and that also need training so that they can enter the job market, and then we have a lower number of need to give work permits. So, Mr. Chairman, I think those are just some icing on the cake, so to speak, that I think the minister can add to this path that he is ongoing. I want to thank him once again for this whole presentation, this whole process of informing the Parliament. As the minister has stated, he always comes with a respect for the parliamentarians and understanding our role in being able to know what our government is doing. And like I said last time, it is clear that we have a minister that truly cares. And that is why we're finally seeing progress with healthcare in our country. Thank you, Mr. Chairman.
Thank you, MP Bryson. The next person is MP George Pantaflet. Before I give the floor, I've been hearing a lot of whispers. Please lower your volume when you are whispering to each other. MP George, you have the floor.
Thank you, Mr. Chairman, and good morning to the chair, my colleagues in Parliament, the Griffier, our Honourable Minister of the S.A. and his support staff, persons who are sitting in the tribune, and those who are listening and viewing by the available medium. Mr. Chairman, I want to thank the Minister for the answers that have been provided. No one can say that being a minister, especially when it comes to the issue of labor, health, and so on, is an easy one. It's an extremely difficult challenge. And if we just look at what is happening all around the world, we'll have to accept the fact that all over the world, Mr. Chairman, governments, organizations, institutions are having challenges when it comes to healthcare, growing population, decreasing workforce, which means more pressure on government to provide the necessary healthcare that is needed. Mr. Chairman, there are 3 words which I will not highlight, but I'll just mention them. When it comes to healthcare, we have to talk about availability, number 1, affordability, number 2, and sustainability, number 3. Those are key issues, I believe, as it regards to the matter of healthcare. Mr. Chairman, I have some questions which might be old, but sometimes, you have to repeat in order to recall what the responses were. If I'm not mistaken, Mr. Chairman, there is a law, an article that says that if someone works 3 days a week at, I think 24 hours or 3 days a week, no more than 16 hours, they are not covered by SZB. But if they work 1 day or 5 days, 1 hour a day, they are covered by SZV. I need to know, Mr. Chairman, if that still exists. So let me repeat. Someone can work 3 days at 16 hours. They are not covered by SZV. We can work 1 hour a day for 5 days, and you are covered. I just want that to be explained so that I can make sure I have it correct. Mr. Chairman, it is a fact, and I would have to agree that most employers and most employees do follow the rules by paying their premiums and so on, by paying their taxes. Something I want to see, Mr. Chairman, implemented, because again, when it comes to healthcare costs, whatever it is, you're talking about money, finances that has to come from government. And Mr. Chairman, it is important that the law, as it relates to pay slips being issued to workers, are enforced. Someone presented me with a letter because they're trying to get themselves registered, and they asked me what should they do. They're employed with this particular employer since 2019, and the employer put on the letter an amount. And when I looked at the amount, I said, well, this is tantamount to about 3,000 guilders a month, which is not bad. But when it came to the pay slips now, Mr. Chairman, it's hard to get their hands on the pay slips. So then I questioned the letter. And as I've said more than once on the floor of Parliament, it is time to do some serious inspection with regards to the issue of pay slips, because it is regulated in the law. In this way, we can prevent those from who probably are withholding premiums and taxes and not paying it to government. As I said, I am sure that the majority of employers and employees are doing their best to uphold the law, but there are always those in between, Mr. Chairman, and as we all know, every cent counts, Mr. Chairman. Mr. Chairman, another issue that I have had over and over, and I've mentioned it again more than once on the floor of this Parliament, is the issue of medication. The issue of medication. So, Chairman, we are part of the kingdom, but there are certain medications, or too many medications, that are available in the Netherlands, but we can't get them on St. Martin. So my question, Mr. Chairman, I asked it once before, and I can't remember what the response was. Why is it? Because it should not be that you can get better medication in the kingdom for those that live in the Netherlands, but we down here can't get similar medication, Mr. Chairman. Mr. Chairman, the Committee for Financial Supervision is always hammering, on cutting healthcare costs and going to generic medication. Well, Mr. Chairman, I know of some persons that tried the generic medication and it did not do them too well. And let me say this, thank God they lived in order to get the medication that works for them. I understand the issue of cost, but it's not only about cost, Mr. Chairman, it is much more about lives, Mr. Chairman. Because I am sure that there's no one in here that would not do their utmost in order to ensure that their health is improved, or even that of their family, Mr. Chairman. That is a fact. I've known of persons who have even put their homes as collateral to get money in order to take care of their loved ones, Mr. Chairman. Without health, you are nowhere, you are nothing. Mr. Chairman, the issue of undocumented persons, when you're around for a long time, you know a lot of things, Mr. Chairman. I worked immigration for about 20-odd years, and I can remember the fights that I had with SZV because I said, wait a minute. You are telling immigration, or you are telling the individual, as long as their documents have not been approved, they can't get medical coverage. And I kept telling them it is nonsense. And even with respect of taxes, I said it is nonsense. If the person is working, they have their crib number, they're paying taxes, has nothing to do with immigration. And if they're working and they're paying a premium, has nothing to do with SZV. Finally, Mr. Chairman, now, even though you're not documented, thank God you can still now get SZV coverage, Mr. Chairman. So these are the things, Mr. Chairman, that are important. So the issue of undocumented and so on, the matter is, how do we control these things to ensure that as much as possible, those responsible pay their due share? Mr. Chairman, the minister have answered many questions. I would not ask any more besides what I've already asked, I think, a statement I made. But what we should always realize is that in order for us to function, in order for government to meet its responsibilities, each and everyone have to do our fair share, Mr. Chairman. Having said that, Mr. Chairman, I want to thank you very much for the opportunity.
Thank you, MP George Pantherflood. The next person is MP Grisha Heyliger-Marten. MP Grisha, you have the floor.
Pleasant good morning to you, Mr. Chairman. Good morning to my fellow colleagues. Good morning to the minister and his support staff. Mr. Chairman, I only have one question, as some of the clarifications and questions that was posed by my fellow colleagues was substantial for me. I'll just await the answers there. But I just have one question, Mr. Chairman, through you to the minister regarding the postponed date to January 2025. What exactly, because I know the date was January 2024 and we moved it to January 2025, what exactly took place, or what's the reason for moving it to 1 year later is my question to you, through you, Mr. Chairman, to the minister. What's the reason for moving the date to January 2025? Thank you.
Thank you, MP Grisha Heyliger-Marten. The next person is MP Angelique Romeau. No need. The next person I see here is MP Solange Duncan. MP Duncan, you have the floor.
Thank you, Mr. Chairman. I only had just a couple of questions to the minister, through you, Mr. Chair. Based on the minister's response to my question about the potential risks and threats with the SAHA, or the implementation of the SAHA, the minister mentioned in his response, one risk is the small scale of our island, makes it difficult for expensive treatments to be available, and also the limited availability of specialties and treatments that make medical referrals abroad necessary. So these are expenses. So the medical referrals will continue, and it's an expense that will need to be borne. So my questions were to the minister, through you, Mr. Chair. And the minister also mentioned fraudulent billing with, from practitioners and so forth. So are there any agreements right now between either government and general practitioners, or between government, or between SZV and general practitioners as it concerns, let's say, pricing? So trying to understand now, when it comes to the cost, if there are agreements in place, and if a general picture can be given to us about that agreement, again, in relation to the cost of healthcare. And also to MP Pantoflet mentioned this continuous debate about generic medicine and, versus brand names, which patients might prefer. So the question is, again, are there agreements between SZV and, let's say, pharmacies on the cost of medicines? What would be, let's say, future agreements possibly between SZV and pharmacies, because our medicines are imported and those are costs as well that will affect the healthcare? Thank you, Mr. Chairman.
Thank you, MP Solange Duncan. The next person on the list is MP Hyacinth Richardson. MP Richardson, you have the floor.
Good morning. Thank you, Mr. Chairman. Good morning to the minister and his staff. Good morning to the persons in the tribune. Good morning to the members of parliament. Mr. Chairman, in the first round, I mentioned pertaining the sustainability of the policy and what I believe should take place. And it was based mainly on the financial situation of the institution. Mr. Chairman, I also mentioned when Cuba was going to develop the strategy of having it all persons insured, that they got involved into the industry of pharmaceutical. These are some of the things I mentioned. However, Mr. Chairman, I also mentioned that I will wait the outcome of the CERD before I say any more. But I would just like to add some things that was mentioned here today, and mention some of the things persons have told me. And some of them have to do with the generic medicine, and also MP George mentioned availability medicine that they can get in Holland that they cannot get here. For instance, I met a lady who has a bag, and she claimed that the bag she had before, the previous one, was working fine. And now SZV decided to give her a bag that is not working, and it's causing a lot of infections in the hotel now. That's all they have. Well, these are things we have to take serious. The institution have to take these things serious, because this causes health issues and more problems for those persons. Mr. Chairman, like I said before, I will await the outcome of the CERD and then proceed from there. I would like to thank you, Mr. Chairman.
Thank you, MP Richardson. That was the last person on the speaker's list. I look to my right now. Is Minister ready to answer, or you need a short break? Ready? I give the floor to the Minister of Public Health, Social Development and Labor, Mr. Omar Otley, to answer the questions posed by the members of Parliament in the second round. Minister, you have the floor.
Thank you, Mr. Chairman. I move to the questions of MP Sarah Wescot-Williams. Under the SAHA, will applicants for resident permits still require to have private insurance? Resident permits as known, of course, the MP is aware, that procedure does not fall under VSA. However, once the SAHA is implemented, resident permits holders and new applicants will be eligible for SAHA, but with a limited coverage until they have contributed for 6 months. So they will be for the basic package. Has the discussion regarding undocumented persons been discussed with the Ministry of Justice? Meetings were held with the Ministry of Justice, and also for these matters is understanding the need for implementation of 2025 to allow other stakeholders the time to roll out their new processes. So it is the intention to have it passed before, but to implement January 2025. And to answer the question of MP Heyliger-Marten at the same time, the issue with 2025 is due to the SAD causing a delay, and the law has to be implemented on January 1st to allow stakeholders, tax department, and et cetera to be ready. And of course, we will not be ready for January 1st, 2024. He moved to the question of MP Sarah Wescott. Can the minister be more specific regarding the ILO recommendations? Well, the ILO recommended the government to refrain from involvement to avoid interference or cause of freedom of assembly of any of the associations. The ILO has offered a mediator to come to handle this situation. MP Panaflet, please explain how it will be under SAHA for someone that works 3 days for 16 hours or work 1 hour a day for five days a week. Under the SAHA, there is no limitation to work hours for residents. Only undocumented persons will be held to a threshold of working hours of minimum 20 hours a week. MP Duncan, are there any agreements with government and SZA and GPs concerning pricing? We have the MTSV, medical tariff, social insurance, which guides what we pay GPs. Are there agreements regarding the cost of medicine? Yes, there are agreements which guides what medicines are allowed to be dispensed in consultation with the Inspectorate of VSA. I would like to, with your permission, Mr. Chairman, to merge, and the permission of the members of Parliament, to merge these two questions together. MP Panaflet, as he spoke of generic medication, and MP Richardson. I would like to make it clear that the generic medication has nothing to do with SAHA. The generic medication was brought about by PCCP, Pharmaceutical Cost Containment Program, which was passed and approved in 2021. So SAHA has nothing to do with the changing from brand name to generic. I would like to dispel that. When it comes to generic medication in the PCCP, there was an automative clause that ensured was there. If anyone has an adverse effect to the generic medication, there is a procedure that can be followed. You go to your GP would confirm this, then you would contact the doctor at SZA, who would confirm this, and then your medication will be reverted back to the medication that you currently used to use. So there is a procedure and probability once you have a negative or adverse effect. I must say though, although there are complaints from certain individuals within the community, SZA to date does not have thousands of complaints. For this year alone, SZA has not surpassed 50 complaints of the generic medication. So I'm not saying that there are not complaints. So what I would advise MP Richardson or any MPs or any of the viewing and listening public, if you do have issues with the generic medication, there is a process. Go to your GP, your GP will contact the doctor at SZA, and then that will be handled. Thank you very much. Immediately.
Those were all the answers? Yes, sir. Okay. Members, at this time, I would ask if there's any member wishing clarification to the questions posed, the questions answered by the minister. I see MP George Pantaflet. I think the minister, before you proceed.
It was not actually a question, but a statement, and I've been confirmed that SFA is actually in the process of looking into the banking process.
Thank you for that, Minister. We go to MP Pantouflet for clarifications.
Yeah, thank you, Mr. Chairman. I don't know if I got the answer, if I understood the answer to the question I put in regards to why is it that medication that is available in the Netherlands, we cannot get it here on St. Martin. Thank you.
Okay. Minister will answer right away. Yes, he will. You have the floor.
Thank you, MP Pantouflet. Also, it's linked to the generic. So we did the PCCP. So we have PCCP Part 2. In this phase, every medication that is available in the Netherlands will be available here. The COM has just approved the plan of approach for PCCP Part 2.
Are there any other clarifications from members of Parliament at this time? I see no need for clarification. Members, with that, we would have come to the end of the deliberations on this agenda point. Now that the second round is concluded, we have not had any motions and we're not voting on any legislation here. So with that, we have come to the end of this meeting. I would like to thank the Minister of Public Health, Social Development and Labor, Minister Omar Otley, as well as the support staff for their presence here today and the answers that has been provided to the members of Parliament, also to those viewing. I would like to thank everyone for your participation in this meeting, and this meeting is hereby closed. Have a good day, all.